Hey guys, welcome back, and today I have a really interesting concept that we're going to discuss, and that is called centralization versus peripheralization. So if you're somebody who has suffered from sciatica or maybe some nerve pain that goes down into the leg or thigh as a result of some sort of disc herniation or disc bulge, then you're going to understand this concept very much so, because you're going to have felt this in the past. And just before we begin, I want you to know that pain does move around. Pain does change, and it could be varying from day to day. It could be very similar from day to day, but it can also vary. So you might have some pain in your hip that goes all the way down the leg, but maybe the next day it doesn't go as far. Maybe the next day it does go all the way around down to the leg, and it wraps around into the foot or something like that. And so these symptoms that you have had in the past or currently have are going to play a major role in your rehab, and it's going to be really important to understand that. So that is where peripheralization and centralization occur. So essentially in the body, what we're talking about is we have here the L5 spine. So here's the S1, and most people are going to have the sciatica that irritates one of these nerves. So let's just point it on this one, right? So this is kind of like the lesion that we're talking about when it comes to that. So this is the sciatic nerve, and it runs all the way down the leg, right? So let's just pretend like this is our man. Here's that L5, and this nerve goes all the way down the leg. So if you're having these problems where you irritate this nerve up here as a result of disc compression, a disc bulge, or whatever it may be, then what you're going to be noticing is possibly pain running down to the back of the thigh, down the back of the knee, into the calf, into the heel, or into the foot. And that is called peripheralization. So that means when pain is coming from the center and it's going downward into the periphery, right? And that's not good usually. That is usually not a good thing. That means the pain is expanding. That means things are going on where you're getting more and more irritation. For every time it passes, usually further down the chain, the worse off you are. Now, when you do exercises, when you do rehab, when you have decrease in inflammation, the goal is to get the pain away. But in order to get it away, we have to start slowly getting it there. The way we slowly get it there is by centralizing the pain. Certain movements like Mackenzie extension, certain protocols can help do that stuff. And that's where being smart with our rehab is really important. So when the pain goes from here, let's just kind of erase that real quick. So that's peripheralization, right? Now that we understand that, now what's going to happen is that maybe the pain goes from here all the way down to the back of the calf, right? It doesn't go further, but then maybe the next day it's not back into the calf. Maybe it's up just above the knee into the back of the thigh or something like this. So now the pain is shifting from going to the periphery. Now we're going to change the direction of it, and it's going to go back towards the source, back towards here, towards the center, and that's called centralization. And that's what you want to see happen over time. Now, you're going to play this game, let's be honest. You're going to play this game where it goes down, but then it comes back, and then it goes down a little further, and then it may come back. But the goal is to have more centralization than peripheralization, because that peripheralization shows more inflammation, more irritation to that nerve. And as a result, if you're centralizing it, that means the disc is less inflamed. You're doing corrective exercises that are helping to centralize that pain, and it's taking pressure off of the nerve roots. And so every time you do an exercise, especially if you're having the sharp, searing, burning, throbbing, numbness and tingling into the foot, if it starts to centralize, that means you're heading into the right direction. If it starts to get worse and you're peripheralizing it, then obviously it is not going in the right direction, okay? So just using this as a concept is going to help you in the future, all right? So knowing this now is going to help you with your rehab in the future. It's going to help you knowing if you're doing the right thing, and it's going to help you feel more comfortable about what's happening with your body and knowing when to take immediate reaction. All right, guys? So hopefully you understand the differences now between centralization and peripheralization. Again, just to recap, centralization is when you have pain all the way down the leg that goes back towards the source and it's starting to migrate back. And peripheralization is when you have pain that's irritating the nerve and it shoots all the way down further away from the spine. All right, guys? So hopefully that is clear to you guys. And now knowing this information is going to just help you in the long run. I'll see you guys soon.